Hello everyone, very good day. Today we are going to talk about the role of pharmacogenetic and non-genetic regulation toward carboxylesterase and precision pharmacotherapy. There are few concepts that we should know. Pharmacodynamic is what a drug do to the body. It's defined as the study of biochemical, physiological, and molecular effect of a drug, and it involves the receptor binding and sensitivity, post-receptor effect, and chemical interactions. In contrast, pharmacokinetic defined as what a body does to the drug, the movement of a drug into, through, and out of the body, and the time course its absorption, bioavailability, distribution, metabolism, and excretion. The precision pharmacotherapy, it involves the use of therapeutic drug monitoring, evaluation of liver and renal function, analysis of other unique patient or disease characteristics, all of these to guide drug selection and dosing. Pharmacogenetic is the study of how people respond differently to a drug therapy based upon their genetic makeup or genes. Carboxylesterase enzyme is a serine esterase and member of large multi-gene carboxylesterase family. These enzymes are responsible for the hydrolysis of ester and amide bound containing xenobiotic and drugs such as cocaine and heroin. Carboxylesterase enzyme is the most abundant drug metabolizing enzyme in human liver. It plays an important role in activating the prodrugs, metabolism of many drugs, biotransformation of active drugs. However, expression and activity of CAS1 enzyme is very variable among individuals. This is due to genetic factors and non-genetic factors. Genetic factors such as gene polymorphism, including single nucleotide polymorphism, copy number variant. Non-genetic factors such as gender, drug-drug interaction, developmental status. So what happens if someone is carboxylesterase 1 enzyme deficient? Carboxylesterase 1 enzyme deficient lead to non-Hodgkin lymphoma, B-cell lymphocytic leukemia, decrease in the tumor-killing activity by monocytes. Carboxylesterase 1 enzyme expression and activity is very variable among individuals. This variability could result in treatment failure and unexpected adverse effect of carboxylesterase 1 substrate drugs. Better understanding of genetic and non-genetic factors will improve the design and clinical use of many drugs that are metabolized, deactivated, or activated by CAS1 enzyme. Pharmacogenetic factors. The loss of function, single nucleotide polymorphism G143E, is currently the only clinical applicable significant variant. In single nucleotide polymorphism, G143E indicate an amino acid change from glycine to glutamic acid at amino acid position 143. G143E is the first loss of function of this enzyme and was originally discovered in routinely pharmacogenetic study of healthy individuals. Methylphenidate is essential to the nervous system stimulant, and it is the most commonly used medication for ADHD disorder. It has been found that when used with alcohol, it has a high potential for violence. Next is G143E and angiotensin converting enzyme inhibitors. This enzyme inhibitor is very well known as first-line heart failure and hypertension therapy. All ACEI prodrugs need to be activated by CAS1 to achieve their intended therapeutic effect. Therefore, patients with carboxylesterase 1 enzyme dysfunction will have a lower ACEI active metabolite concentration compared to normal individuals. G143E and Tamiflu. The loss of carboxylesterase 1 enzyme activity could profoundly impair the alsalemi activation. Non-genetic factor affecting carboxylesterase 1 enzyme expression and activity. Developmental expression of carboxylesterase 1 enzyme. It has been shown that expression level is directly correlated with age. Overall, expression and activity are lower in neonates and pediatrics. CAS1 enzyme expression is higher in female than males. However, further study is needed to examine the impact of sex on the CAS1 expression level and pharmacodynamic and pharmacokinetic of CAS1 substrate. Ethanol is the only non-CAS1 inhibitor confirmed in multiple studies conducted in vivo and in vitro.